Welcome to the Policy Visibility Drive, a Ghana Health Service policy initiative created to enhance the exposure of policies, manuals, and guidelines within the health sector. In this video, we shall be focusing on the national standards for newborn health services in Ghana. In 2015, the deadline for the Millennium Development Goals expired, at which point Ghana had not achieved Millennium Development Goal 4, largely due to stagnation and occasional rise in the neonatal mortality rate for over a decade. This pointed to the need for more work to be done by all stakeholders towards the achievement of significant reduction in the neonatal mortality rate of 29 per thousand live births as of 2014. A significant reduction in neonatal deaths will effectively impact the overall decline in deaths of children under 5 years in Ghana. In order to focus efforts and resources on improving newborn health, the Ghana Newborn Strategy and Action Plan 2014 to 2018 was developed by the Ministry of Health and the Ghana Health Service with support from partners. It provides guidance for scaling up evidence-based intervention to reduce neonatal mortality and improve newborn care practices. The Ghana Newborn Strategy and Action Plan 2014 to 2018 focused on essential newborn care and includes the following components. 1. Basic essential newborn care, primarily preventive and promotive care at birth and in the postnatal period with special focus on the first week of life when 75% of deaths occur. 2. Management of adverse intrapartum events including birth asphyxia through basic neonatal resuscitation. 3. Care of the preterm or low birth weight baby including kangaroo mother care. 4. Management of sick newborns with a focus on neonatal infections. The intervention package in the current Ghana National Newborn Strategy and Action Plan 2019 to 2023 builds on essential newborn care at all levels of the health system and additional facility-based care for at-risk or small and sick newborns. The Standards for Newborn Health Services in Ghana is a document to guide healthcare providers at different levels of care on the services to be provided as well as the equipment, supplies and medicine and staffing needed. Policymakers, health managers and service providers shall all work towards meeting these standards in order to provide the needed quality of care for all newborns. Statements on standards for newborn care. This outlines 20 statements regarding quality of care, a matter that requires assessment, improvement, and monitoring within the health system, which addresses issues related to service delivery by health professionals as well as to the experience of care that clients, patients, and their relatives receive. 1. All women, newborns, and their families shall receive health care with respect and dignity. 2. Communication with women and their families shall be effective and in response to their needs and preferences. 3. Families have the right to information concerning the condition and care of their newborns. 4. For every woman and newborn, competent and motivated staff shall always be available to provide routine care and manage complications. 5. Every woman shall receive evidence-based routine care and management of complications during labor, childbirth, and the postnatal period, according to safe motherhood protocols. 6. Women in preterm labor shall receive appropriate interventions for both the woman and the baby according to safe motherhood protocols. 7. No woman or newborn shall be subjected to unnecessary or harmful practices during labor, childbirth, and the postnatal period. 8. Every newborn shall receive evidence-based essential newborn care and management of complication as appropriate at birth, immediately after delivery, and during postnatal period according to national standards and protocols for newborn care. 9. Newborn shall receive early initiation of breastfeeding immediately after birth, except where medically not applicable. 10. Preterm and low birth weight babies shall receive appropriate care including kangaroo mother care, according to the national standards and protocols for newborn care. 11. All districts, regional and tertiary hospitals shall provide rooms for kangaroo mother care services. 12. Every woman and newborn with a condition that cannot be managed effectively with the available resources shall be appropriately referred. 13. Infection prevention and control practices shall be strictly observed during labor, childbirth, and the neonatal period. 14. All labor wards and delivery suites shall have well-equipped designated resuscitation areas for newborn care in the same room to allow resuscitation to begin immediately without more than 10 seconds delay after birth. 15. All hospitals shall have a separate room, ward, or department for inpatient care for sick newborns. Mothers shall have ready access to their babies. Well newborns shall be roamed in with their mothers and shall not be in the sick newborn unit. 16. The health facility shall have an appropriate physical environment with adequate utilities including water, electricity and other energy, sanitation, hand washing and waste disposal, medicines, supplies and equipment for routine maternal and newborn care and management of complications. 17. Every woman and newborn shall have complete and accurate standardized medical records during labor, childbirth and postnatal period. 18. Every health facility shall have a mechanism in place for data collection, analysis and feedback that meets national standards as part of its monitoring and performance improvement activities. 19. All health facilities shall facilitate the registration of all newborns with the National Health Insurance Scheme and the Births and Death Registry. 20. Health facilities shall plan, budget, advocate and allocate resources for newborn services. The neonatal period is generally defined as the first 28 days of an infant's life. However, infants may be cared for in a neonatal service area for more than 28 days, depending on the time from birth to discharge. If you've liked this video so far, please give it a thumbs up and subscribe to the official YouTube channel of the Ghana Health Service. Comment down below to let us know what you think and click the card above to watch all policy visibility drive videos. Standards for newborn care at sub-district and community levels. CHIPS compounds with midwives, health centers and maternity homes shall have space within the labor room for providing immediate and essential newborn care to all newborns. Services provided include basic neonatal resuscitation, routine care. This includes thermal care, cord care, eye care, vitamin K1 administration, examination of the newborn, measurement, early initiation and exclusive breastfeeding, care of baby whose mother has HIV, TB, syphilis, hepatitis B, emergency care before referral, monitoring and immunization. Management of a sick baby. This includes care of newborns with temperatures 35.5 degrees Celsius to 36.4 degrees Celsius. Care of stable newborns with birth weight 1,880 to 2,000 grams. Care of the well baby not able to feed directly from breast, as well as care of newborns with minor infections. Early appropriate quality postnatal care. Referral services and infection prevention and control. Standards for newborn care at district and regional levels. Services provided include basic neonatal resuscitation or advanced neonatal resuscitation if pediatrician is available. Routine care. This includes thermal care, cord care, eye care, vitamin K1 administration, examination of the newborn, measurement, early initiation and exclusive breastfeeding, care of baby whose mother has HIV, TB, syphilis, hepatitis B, emergency care before referral, monitoring and immunization. Management of a sick baby. This includes care of newborns with temperatures 35.5 degrees Celsius to 36.4 degrees Celsius. Care of stable newborns with birth weight 1,880 to 2,000 grams. Care of the well baby not able to feed directly from breast, as well as care of newborns with minor infections. Early appropriate quality postnatal care. Referral services, infection prevention and control. Newborn screening for sickle cell disease and retinopathy for prematurity, and kangaroo mother care. Standards for newborn care at tertiary levels. Services provided include basic and advanced neonatal resuscitation. Routine care. This includes thermal care, cord care, eye care, vitamin K1 administration, examination of the newborn, measurement, early initiation and exclusive breastfeeding, care of baby whose mother has HIV, TB, syphilis, hepatitis B, emergency care before referral, monitoring and immunization. Management of a sick baby. This includes care of newborns with temperatures 35.5 degrees Celsius to 36.4 degrees Celsius. Care of stable newborns with birth weight 1,880 to 2,000 grams. Care of the well baby not able to feed directly from breast, as well as care of newborns with minor infections. Early appropriate quality postnatal care. Referral services, infection prevention and control. Newborn screening for sickle cell disease and retinopathy for prematurity, and kangaroo mother care. Newborn monitoring forms. It is important to monitor vital signs and other essential parameters of care for both healthy and sick newborns during their stay in the health facility. Monitoring of newborns is essential to detecting danger signs quickly and allows for life-saving interventions to commence as soon as possible when necessary. The vitals monitoring chart is used by the clinical staff for monitoring the vitals of a sick newborn. The form monitors vital signs of the baby such as respiratory rate, heart rate, and temperature. It also monitors the color of the baby, SpO2, and other vitals. The danger zones on the chart have distinct shadings, and an included key guides the use and interpretation for decision making. Listed below are monitoring forms for both the sick newborn and the well newborn. Newborn inpatient monitoring chart, random blood sugar monitoring form, seizure chart, newborn IV fluids or feeding chart, newborn output chart, newborn examination form, healthy newborn monitoring form, and newborn head tickets. Please note, this video only contains an abridged version of the policy document or publication. To access the full document or for further reading, kindly visit the Ghana Health Service website at www.ghs.gov.gh. Thank you for your time and attention.